Here you can see use of the Cellon method for the treatment of habitual snoring by tautening the soft palate with the Cellon Pro Sleep applicator. Administration of a 50 mg diclofenac tablet as a preoperative preventative measure against pain is recommended. Inhibition of the retching reflex by means of superficial anesthesia may also be necessary, for example by spraying the area of the palate and lower pharynx with a 10% lidocaine aerosol. For local anesthesia, the injection of 0.5 milliliters of 2% lidocaine solution containing adrenaline near the median plane directly below the boundary between hard and soft palates is recommended. After 3 to 5 minutes, this is followed by 3 to 4 0.5 milliliter injections into the area of the upper palatoglossal arches. These injections have the additional effect of enlarging the palatal volume during the operation and reducing the risk of mucous membrane damage. The size of the coagulation arising depends on the power setting of the control unit. A setting of 10 watts is recommended for treatment of the soft palate. The larger the power setting, the shorter the application time and the smaller the extent of coagulation. The curved applicator needle is adapted to the anatomy of the palate. It's inserted into the center of the palatoglossal muscle until the insulation tube of the applicator touches the tissue. The needle tip may not be inserted as far as the uvula. Make sure that the probe tip is located as far as possible in the middle of the tissue to avoid lesions on the surface of the palate at the front or back. The first puncture with 10 watts should be located about 15 millimeters above the highest point of the palatoglossal arches. The second puncture approximately 8 to 10 millimeters above it. Two further punctures are carried out approximately 5 millimeters to the left and right, this time with a power supply of approximately 13 watts. Further punctures are also possible depending on the anatomy. After positioning the probe, the power supply is activated by pressing the foot switch. The status of coagulation can be controlled by the acoustic signal. The increasing pitch of the signal indicates the progress of coagulation and the increasing tissue impedance. The power output is controlled automatically. Completion of the coagulation process is signaled by a high-pitched interval sound. The power supply is reduced automatically. Overdose effects are excluded. Should the mucous membrane pale towards white during the application, the power supply should be discontinued immediately. Otherwise, damage to the mucous membrane may occur. The probe can then be repositioned and power supply reactivated. Where the soft palate is very flat, a somewhat higher power setting may be of assistance for obtaining smaller lesions. Should it be necessary, we recommend alleviation of post-operative pain with analgesics such as ibuprofen or diclofenac. Volume reduction accompanied by a tautening of the palatine tissue is apparent within the next 1 to 2 weeks as a result of scarring and the body's own resorption process. Experience has shown that 2 or possibly even 3 surgical interventions may be necessary to achieve optimal tautening results. The follow-on interventions should only be conducted when the previously coagulated tissue has been discarded by the body. This is the case approximately 4 to 6 weeks later. We wish you much success using the Cellon method. For further information, please contact Cellon directly or visit our internet site at www.cellon.com.